I just wanted to get started by giving a little bit of background to Integrated Design Studio. We are a team of over 20 designers that specialize in the design of dental offices only. Our designers work in partnership with our equipment specialists throughout the US to create these projects. And in addition to space planning, we also offer 3D visualization, equipment placement and specification, and we have an interior design consultation service. A little bit about what you can expect out of today's session. I will get started by talking about the foundational principles of good design and how we apply those principles to a dental environment. We'll also review current societal trends that have informed the development of our design philosophies at IDS. Jen will talk about targeting your ideal demographic with the services and amenities that you plan to include at your practice. And she'll also review IDS's 3 practice philosophies and talk about how you can design an office with those principles in mind. To wrap things up, I will take a look at a blended solution that incorporates trends from each philosophy. So we will get started today by talking about the building blocks of our design philosophy. At IDS, we talk a lot about focusing on 4 basic principles as part of our foundational philosophy. This includes zoning, flow and function, use of space, and the user experience. When we talk about zoning, we're typically referring to 3 functional zones: the public, clinical, and private spaces. The public zone is going to be more patient-focused, a lot of interaction between patients and staff, and less of a need for privacy. This typically will include the waiting room, business office, patient amenities, and consultation. The clinical zone is where your clinical treatment spaces, as well as all support spaces, will be. Generally, this is going to be the imaging alcove, treatment rooms, sterilization, lab, staff support, and storage. And then lastly, the private zone is really meant for your staff functions. So the staff lounge, a private office, staff amenities, and then often a dedicated staff exit. You can see on this color-coded diagram that we have our zones nicely divided with no overlap. This is typically what we're trying to achieve when we're laying out a space. There are a number of topics that fit within the flow and function category, one of them being room adjacencies. It's a pretty simple concept that spaces that have a functional relationship to each other should be placed nearby one another, and spaces whose functions we don't want to overlap are spaced apart from each other. This is going to help support both patient and staff flow, as well as functionality within the space. When we talk about circulation, we are referring to the paths of travel that both patients and staff take throughout the space. Our goal is to create direct and efficient paths of travel between spaces that have a relationship to each other. An effective circulation pattern is going to avoid any sort of cross traffic and congestion within the practice, and is a really effective way to further enhance privacy and separation between the zones. It's also a way that we can support intuitive wayfinding for patients. We know that most patients who come into the space are only there a couple of times a year, and we want to make it easy for them to find their way in and out of the clinical zone without accidentally going down a hallway we'd like to keep them away from. Other topics that support effective flow and function include appropriate room sizing and layout. While this is critical throughout the practice, we want to make sure that rooms are sized appropriately to support the function needed within that space. It's especially true in the clinical zone. Our team is going to work to make sure that the treatment spaces are sized and set up appropriately to support ergonomics for the practitioner as well as staff, and that the arrangement and the fit of the equipment will function. This image is also demonstrating sterilization centralized to treatment rooms to support efficient staff workflow. When we talk about the use of space, we are referring to how the square footage is being used. So it's important upfront to assess what square footage requirements you may need, depending on the number of treatment rooms you're trying to fit within your space. Our team is always going to work to allocate the square footage that's available to us in a way that is proportional and appropriate across the space. So for example, if you have a 2,000 square foot tenant lease space, it wouldn't necessarily make sense to dedicate 800 square feet of that to the staff lounge. We want to make sure that we're using the space available to us as efficiently and effectively as we can. This also refers to taking advantage of the best features of the space. I think we most often think of windows and access to views and daylighting as being something that we try to capture for treatment rooms, the waiting area, both patient and staff spaces. It also might mean that we're designing around existing conditions, such as columns, door locations, things that we can't necessarily change about the space itself. It's really important to consider the user experience in any space. And when it comes to dental practices, we break that down to the patient experience versus the staff experience. Ways that we can support a positive patient experience include effective room adjacencies, managing the lines of sight that a patient might have throughout the space, sound control, a focus on aesthetics, access to natural light and views, and of course, patient privacy. We don't want to forget about creating a positive staff experience. I think oftentimes people put an emphasis on the patient experience, but we don't want to overlook what the staff is dealing with on a day-to-day basis. Probably the most critical way that you can impact this is with clinical functionality. Are you providing an ergonomic work environment within the treatment rooms? Is the clinical zone overall set up to support an efficient workflow? This is going to have a lot of impact on the way that your staff experiences their day-to-day. We don't want to forget about natural light and giving staff access to that as well as views. We'll talk today about opportunities to incorporate patient amenities and also ways to provide privacy for staff. Now that we've gone through the foundations of what we consider successful design and our foundational design philosophy, I want to discuss ways in which that we need to be aware of changes within the world around us and things that are happening within our society so that as designers, we can evolve and be responsive to the needs of the end user. So keeping that base philosophy in mind, what are some of the considerations that we took as we were creating the 3 philosophies that Jen will be reviewing? Some of these things include the fact that stress overall in the last few years especially has been at an all-time high. We have seen an increased focus on individual mental wellness and behavioral health. Accessibility and inclusivity within all built environments, but especially within healthcare facilities, is something that we have seen a lot of increased awareness over in the last few years. And these are ways that we can provide more equal experience to users of all abilities. The cost to build has gone up, which has forced us to take a look at how we can incorporate multi-purpose and flexible spaces within an environment. More people have more of an emphasis on the need for personal privacy and separation within the spaces that they interact with. All of us in general have higher expectations for the built environment. We live in a very visual world where interior trends are changing rapidly, and people just expect a lot more out of the spaces that they interact with. Staff satisfaction and retention is an issue, and we've all experienced in the last few years that the way that we live and work is constantly changing. A lot of that being driven by technology and, of course, the implementation of artificial intelligence. Lastly, we have seen intergenerational conflict, and what they expect out of the spaces and experiences that they have has been on a rise. So how do we respond to those pressures and rethink what we are providing to users of a space to meet some of those evolving needs? As our team conducted research into developing our philosophies, we found some common themes that helped us to create 4 guideposts that we used as we looked for solutions to these issues. The guideposts include wellness, flexibility, comfort, and technology. Jen is going to be reviewing a lot of specific solutions that fall within those guideposts, but generally speaking, the way that we have responded is by focusing more attention on wellness spaces, equal access to nature and daylight, looking for opportunities to enhance accessibility in a space to create that equal user experience. We've been evaluating where square footage is the most valuable, which has caused us to really seek out opportunities to save space and look for multi-purpose and flexible solutions. We're putting more emphasis around the need for personal space and privacy. And of course, as we talk about interiors, we're putting a focus on aesthetics and amenities. You'll see us look at many solutions today that incorporate technology as a way to enhance the patient experience and showcase the investment in technology in a practice to boost overall patient confidence. So at this point, I will pass it off to Jen.
Thanks, Laura. Now that Laura has kind of given us a little bit deeper look at building a foundation for a successful design and also identified those 4 key guideposts, we're going to talk a little bit more about how we incorporate them into our design approach, focusing on growth aspirations, targeted patient demographic, and practice philosophy. So getting started, talking a little bit more about future aspirations. I think we can all relate that whenever we're tackling a large project, it's easy to get caught up in what your needs are for this very moment and today. But it's also important to think about the long term and making sure that you've taken into account what some of those future needs might be to ensure longevity of your practice for years to come. So starting with the opportunity to expand a space. Something to think about when selecting a space is whether there's an opportunity to expand, whether that's an adjacent suite or additional space that might be available on the lot. If the opportunity presents itself, it'll be important to think about what those potential breakthrough points might be to make sure that you can support that future growth and, of course, ensure that you maintain that proper flow and function that you work so hard to achieve even as your practice grows. Second, team expansion. As your practice grows, you might want to think about preparing for either an associate or a specialist down the road. You can incorporate some multi-purpose or flexible use spaces to not only support your needs today, but also plan for those future needs. And we'll dig into this a little bit more on how you can incorporate those spaces. Lastly, I think we can all recognize that technology is constantly evolving. Whether you decide to incorporate all of the latest technologies when you build your new practice or slowly integrate them as your practice grows, it will be important to think about what those potential power, data, reinforcement, and additional space requirements might look like and plan accordingly. Second, demographics is a key factor in selecting a site. Before you commit to a location, make sure that you've done your research and really understand the surrounding community. Identify who you believe is going to be your most common patient or those you would like to attract, and dig in a little bit more to determine what their needs and expectations might be. Some considerations might be just thinking about, what is the patient looking for? What are their dental visit habits and desired services? What is their preferred style of communication, and how do they assess their ability to trust you? Lastly, what influences their decision-making when they're looking to find a new practice? So keeping those in mind, we're going to talk a little bit more about how we can integrate those into the overall design. Our team has identified 3 key philosophies that help to align with specific targeted demographics and also a way to make sure that we're meeting those practice goals. So we're going to dig into each one of these a little bit more, starting with traditional. The traditional design approach is going to be very similar to what we've all become accustomed to over the years. It's going to feel familiar and comfortable, offering that sense of community, fostering a family-centric space with that added personal touch, and also making sure there's added opportunities for engagement throughout the space. Some key components that are included with that traditional style approach include that traditional reception and checkout that we've become accustomed to, incorporating multi-purpose rooms and flexible treatment rooms. Before we dig into those key components, we're going to take a look at a space that was designed with traditional in mind. The space we're looking at is 2,900 square feet. We were able to incorporate 7 treatment rooms, which came out to about 414 square feet per treatment room and support spaces. Reflecting back on those key functional zones that Laura talked through a little bit, we're going to revisit those in this traditional design approach, starting with the public zone, which includes the reception and waiting, business, a flex room, and a patient restroom. Followed by the clinical zone that includes our treatment spaces, sterilization, lab, and imaging. Followed by our private zone tucked off to the side, which includes the staff lounge, cylinder closet, private office, and mechanicals. So first, we'll take a look at that patient circulation. As you can see here, we have great circulation from the reception all through the clinical space with no reason to move into that private zone. Taking a look at our staff circulation, that same circular flow around the clinical space, nice connectivity between either side of the office through the sterilization, and easy access to that private zone. So as we dig into the traditional style approach, we are going to introduce you to a patient profile just to help make it a little bit more relatable and thinking about how we align to those patient demographics. So our first patient is Joe. He's a 75-year-old male. He's married and lives with his wife, Rebecca, in a suburban community. When it comes to looking for patient care, he's looking for a place for him and his wife, who is currently suffering from the early stages of dementia. Joe acts as a full-time caretaker and looks for shared or back-to-back appointments to reduce the time spent out of their normal routine. When it comes to trust factors, he relies on word of mouth, friendliness, and understanding from the dental team. He typically goes to the dentist for a biannual checkup, general oral exam, and care to avoid tooth decay or loss. His influences include family, friends, and community, media habits, paper and TV news, along with Facebook. When it comes to communication, he prefers to have a good old-fashioned phone call. So keeping Joe and his wife, We're going to take a look at that traditional style approach, starting with the waiting and the reception. As you can see here, as someone such as Joe and his wife enter the space, they're easily greeted off to the left and have various seating options off to the right that offer added privacy or also could accommodate a larger family. With any style approach, it's important to think about additional amenities for that added level of comfort. That might include making sure that there is an empty space where a wheelchair could be parked, adding in a media bar, kids area, and beverage station. Moving further into the space, we'll take a look at a multi-purpose room. Here we've created a larger space that can accommodate multiple practice functions all in one space. That might mean new patient onboarding, consultation, private check-in or checkout, teledentistry, photo and scanning, or even serve as a private waiting space. As you can imagine, someone such as Joe and his wife would appreciate a space like this, being able to stay in one room versus moving from location to location, reducing their overall stress during their visit. Moving further into the clinical zone, we'll take a closer look at that flexible treatment room we had mentioned. We've created a larger room that allows for added functionality, comfort, and privacy, which can support a little added space for mobility devices. You might think about incorporating a designated space for a caretaker or family member, a little bench or an additional chair. This space could also serve as a consultation within the treatment room versus relocating to another space. And as you can see here with that added space, it may allow for specialty procedures, keeping in mind that team expansion and future needs. If we take it one step further, we can create some openness between two adjacent rooms. So as you can see, this room could serve as a single private room, but also open up and be more for a family pod. So someone, again, as Joe and his wife, this allows for both of them to have their treatment at the same time. Lastly, keeping flexibility in mind, this could serve as a private joint room, but if you were looking to bring in a specialty, this might be an ideal scenario if you were to bring in an orthodontist. Creating additional adjacent suites that allowed for that openness may be ideal for an orthodontist that prefers to have more of that open concept throughout. Moving into our next philosophy, we are going to take a look at the concierge approach. Concierge is going to create more of that sense of luxury and comfort, similar to what you might find in a high-end hotel. So think VIP experience. This might be ideal for practices that provide longer or more specialized procedures. Some key points of this approach include keeping more of a minimalistic reception, focusing on that inclusive patient experience, incorporating larger treatment suites for that added comfort and privacy, and some added luxury amenities or services. Before we dig into these key components, we're going to once again take a look at a floor plan that was created with the concierge style approach in mind. Once again, we started with the 2,900 square feet. This time around, we were able to incorporate 6 treatment rooms, which came out to 483 square feet. So still able to make the most out of the space while incorporating some larger, comfortable private rooms. Breaking it down into those 3 functional zones, starting with the public zone. This is going to house our waiting and reception, patient restroom, consult, and we've incorporated the imaging space within this public zone. Moving into the clinical zone, once again, those larger private suites, treatment rooms, sterile, and digital lab. Followed by the private zone, which houses the staff lounge, additional restroom, changing, and private office. Taking a look at that patient circulation, once again, we have great circular flow throughout the public and clinical zone. With no need to venture into that private zone off to the right. The staff circulation has that same circular flow, but easy adjacencies to the staff lounge and private office. So as we dig into this next approach, I'd like to introduce you to our next patient. This is Natalia. She is a 45-year-old female. She's married and lives in a suburban community. She's looking for all-in-one services and amenities. When it comes to trust factors, she relies on ratings, influencers, coworkers, and family members. She typically goes to the dentist for her biannual checkups, cosmetic dentistry, teeth whitening, and would love to have a place where she could also do Botox. Her influences include friends, celebrities, and health and wellness bloggers. Media habits include Instagram, Facebook, and blogs. When it comes to communication, she's rather flexible and she'll pick up the phone, answer an email or a text. So keeping Natalia in mind, we are going to explore the concierge design approach, once again starting with the waiting and reception area. Taking a look here, you can see we still have a personal greeter, keeping the space somewhat minimized with the idea that once Natalia enters the space, she will be greeted and quickly escorted to the comforts of her own VIP suite. We have incorporated some lounge seating off to the right, just in case someone needs to wait for a moment. Lastly, again, putting some emphasis on the amenities and services, that VIP experience. You want to make sure that we're creating sight lines to whatever may be available to the patient. Moving further into the space, we'll take a closer look at that larger treatment suite. As you can see here, we've created a space that can house, once again, multiple practice functions all in one space. You might consider consultation within this space, post or pre-treatment, and also checking out and reappointment all in one room without the need to relocate to another space. Again, thinking about luxury and added patient comfort, we'll want to make sure that we add in some added accommodations and amenities that might include some comfy guest seating or work surface, TV, headphones, and a charging station, and storage for belongings. Know that a patient in this space might spend a little added time. We want to make sure that they are as comfortable as possible and feel at home. Lastly, just touching on amenities. Once again, we want to create that luxurious and memorable experience. Some support spaces or services to include in this might be teeth whitening, reveal aligners, cosmetic dentistry, dermatology, massage therapy, or Botox. Anytime we incorporate a specialized amenity room, we want to make sure that we're thinking about future needs and also flexibility. So we would highly recommend creating a space very similar to the size of a treatment room. So this could be utilized as an overflow exam or hygiene space as needed. The last design approach we're going to explore is self-guided. I think this one kind of speaks for itself. It really embraces today's technology and offers users that individual sense of control. It's going to be highly patient-centric and have some enhanced wayfinding. The self-guided experience should also incorporate some opportunities for increased efficiency and higher production. And we'll take a closer look at what this looks like. Some key points of the self-guided include a digital check-in and check-out, new patient experience, and efficient consultation options. Before we dig into those key points, we're going to once again take a look at a floor plan that was developed with self-guided in mind. Once again, we started with 2,900 square feet. This time around, we were able to incorporate 8 treatment rooms that came out to 362 square feet per treatment room. So again, keeping efficiency in mind and making sure that we can support a high productive office. And we'll take a look at how we achieve this. Once again, breaking it down into those functional zones, starting with the public zone. We have the patient restroom, a business office, waiting, a stand-up consult, and a flex room. Moving into the clinical zone, we have our treatment rooms, sterilization, and the lab tucked behind, along with our imaging off to the left, followed by our private zone tucked off to the right. Taking a look at the patient circulation, this looks a little bit different than the last two layouts that we looked at. We had that circular flow around the entire clinical zone. In this case, we created a more focused pathway for patients. Again, thinking about enhanced wayfinding and focusing on that patient experience, we have tucked all the clinical supports behind the scenes. Taking a look at the staff circulation, we were still able to maintain that circular flow for staff. They have great connectivity from the clinical zone to the back support spaces and also adjacency to that private zone tucked off to the right. By minimizing the hallways, we were able to incorporate an added treatment room. So once again, I'd like to introduce you to our third patient. Meet Carly. She is 26, female, single, and lives in an urban community. When it comes to looking for a dental practice, Carly would love to be able to make her own appointments and have some flexibility. When it comes to trust factor, she checks ratings and referrals by coworkers and friends. She typically goes to the dentist for checkups, cosmetic dentistry, teeth whitening, and alignment. Her influences include beauty and music celebrities. Her media habits include TikTok, Instagram, and streaming. And when it comes to communication, she would prefer a quick text message. We're going to take a look at that self-guided experience, starting with the waiting and reception area. We've incorporated a digital check-in to really eliminate the need for that added engagement for the patient once they arrived. Someone such as Carly might have even checked in on her mobile device before even arriving. A self-guided experience can really vary. In this case, we've created a business office kind of behind the scenes with visibility into the waiting area. A practice might decide just to maintain a small reception desk just to maintain some of that in-person support. Moving further into the space, once again, taking a look at that patient pathway, we've allowed for easy navigation and wayfinding with the numbered doors. As you can see here, we've kept all of those staff areas tucked out of view, while creating a patient experience that someone such as Carly could have a little bit more independent exploration on the way to her treatment room, added patient education, and a great opportunity to highlight the technology available within this office. Lastly, we want to touch on some consultation options, keeping flexibility in mind. While a private consult might be a little bit better for those longer conversations or new patient onboarding, we would also recommend implementing some smaller scale solutions along the way. So that might mean making a little added nook off of the hallway or a semi-private alcove like you see here. A practice might also consider just keeping consultation within the treatment room, keeping efficiency in mind. So once the patient finishes up, they can exit the space. Now that we've explored 3 key design philosophies, Laura's going to talk a little bit more about how you might implement those, keeping your practice goals in mind.
Thanks, Jen. We recognize that these philosophies are really a starting point, and while some practitioners may be trying to reach a target demographic, many will be looking to capture multiple demographics. Every project is unique, and we really want to encourage you to think about which takeaways are going to help you meet your overall practice goals and enhance the user experience. All of this will ultimately have a positive impact on your business. This last plan that we'll be looking at is around 5,300 square feet, has 10 treatment rooms, and incorporates several takeaways from the different philosophies we looked at today. Here we have our public zone, our clinical zone, and our private zone. Taking a look at the front desk, we see an opportunity to offer a traditional reception desk for those patients who might be looking for more of a personalized, high-touch check-in experience. But we're also blending that with a self-check-in kiosk that's meant to reach more of that tech-savvy demographic. To the left of this image, we see intentional product display incorporated. This is something we want to encourage people to think about early on so that it is built into the practice rather than ending up with things kind of scattered across the front desk. One of the things that I talked about earlier on in this presentation is the need for personal space and a little bit of separation. So gone are the days where we are just lining up chairs around the perimeter of the room. We're really encouraging people to think about creating different zones of seating to help support that sense of separation. In this image, we also see a variety of seating incorporated, which is going to support different demographics using the space. The armchairs are going to be great for patients who might be a little bit older or have mobility issues and need help getting in and out of a chair. The love seat is going to be a really nice opportunity to offer a comfortable space for patients of different sizes or those who might be coming in as a group or a family. And then finally, to the left, we see some counter height seating. That's a nice opportunity for someone to charge up a device or maybe sit down and get a little bit of work done on their laptop while they're waiting. This image is demonstrating more of that traditional checkout, as well as multifunctional spaces directly adjacent to it. So the two kind of private office spaces that we see are opportunities for consultation. Maybe someone needs more of a quiet or private checkout experience, treatment planning, or maybe just a quick, quiet conversation with a staff member. These spaces are really meant to serve multiple purposes. The image that we're seeing here is demonstrating these spaces really nicely rendered in glass, but if you're looking to incorporate even more flexibility into these rooms, you might provide a little bit more of a private space that could be used as maybe a mother's room or a calm down space for a patient who has elevated anxiety. This image is demonstrating a flexible treatment area. Here we have what we think of as a traditional treatment room with dual entry openings at the 12 o'clock wall, but you'll see that we've also incorporated openings at the toe end of the room. This is another option that could be great for families that are coming in and having treatment at the same time. It gives an opportunity for mom or dad to pop back and forth between the treatment spaces and is also an alternative way for staff to get between rooms rather than going back out into the busy corridor. Here we have a private treatment suite. If there's one takeaway that I would encourage anyone who's planning an office to really consider, it would be including a larger private treatment room. These spaces can provide a lot of different flexibility for patients who might have different needs, those who use a mobility device, maybe patients who would really benefit from a quiet space, or those who have a guest accompanying them. In this image, we see some really beautiful built-in bench seating that could also be an opportunity for a patient who might just be in for a longer treatment to get out of the dental chair and sit down while they're waiting. This image is demonstrating a centralized sterilization with a view into a 3D lab. We're really highlighting the investment into the 3D printing system, This is an opportunity to engage that patient demographic that's a little bit more tech savvy and sees that investment into technology as a way to boost their confidence in the practice. Here we have an opportunity to work cart storage into an alcove along the hallway. You'll also see that we've incorporated a flexible workspace for staff. This might be an opportunity for ordering, maybe stand-up consultation, or if you need an alternative option for checking out, it could be a checkout along the hallway. We've talked a lot today about not overlooking the needs of your staff. And what we see here is a nice opportunity to incorporate some locker storage, space for personal belongings, as well as a flexible quiet room. That small quiet space could be used for a number of different things, whether it's a mother's room, an opportunity for someone to step in and make a quick personal phone call, or just another area for a quick private chat with a staff member. So to round things out, I just want to review some of our key takeaways. Keep in mind those foundational principles of good design that I discussed early on and how we might apply these to the dental environment while also incorporating societal trends. As you're planning your practice, think about your target demographic so that you can align your design philosophy appropriately. Don't forget just about your current goals, but also think about your long-term goals when you're designing your space so that you'll be ready for growth and evolution when the time comes. And then finally, evaluate which solutions will best fit your practice style, enhance your patient experience, and help you to meet your overall practice goals.